Okay, we're back. So, welcome to Clinician Voice podcast. I'm excited today to have our guest, who's a true force of nature in healthcare innovation and nursing advocacy. Tanya Abreu is the visionary behind PowerUp Nursing, a movement focused on empowering nurses with tools, resources, and radical support. Can't wait for her to tell you all about everything that she's doing. Her work is grounded in years of healthcare strategy, patient experience innovation, and unwavering belief in value of nursing. So let's get into it. The first thing, and welcome, Tanya. How are you?
Oh, thank you, Dr. Robin. I am very delighted to be here. I know this will be broadcast at different times, but it's the first day of Nurses Week, Cinco de Mayo, all kinds of festivities in the air for nurses and independents. And so it's so appropriate to speak to you, Robin. I'm so excited.
Great. And it's exciting to have you here. Like, we're speaking to a few visionaries this week, and you've been doing some amazing things and just standing out. I see you on LinkedIn quite a bit, and I'm very excited to just work with you and hear about the things that you're doing. So, but first, I want to start with just, the elephant in the room. The biggest piece of this is that you're advocating for all of these nurses, but you're not yourself a nurse. So tell me, how did we come to have your support?
I would love to. It is a long, but in the end, a perspective short story. I was working on my PhD and teaching in the Graduate School of Industrial Management at Carnegie Mellon University in Pittsburgh. And I received a Fulbright scholarship to teach at MGU, Moscow State University. My background, I speak Russian. I was raised by a Russian father. And so it just made sense. So I left as a professor and worked for a year. But because I knew the language and because I liked to communicate and I could do translation and interpretation, I was asked by the Chautauqua Conference to be a translator for women's health and women's health reform in Russia. And I did that, and it just transformed my life. I came back to Pittsburgh with the help of a grad student who was working for me, went to McGee Women's Hospital, the University of Pittsburgh Medical Center, and said, hey, the US government, USAID, is giving money to hospitals to help reform healthcare in the former Soviet Union. And long story short, we got about 80% of all money that was coming in to US hospitals. And we built 55 women's health centers throughout Russia, of which about half of them are still in operation 30 some years later. But while I was doing that, I just, my God, fell in love. I'd always loved language, and I thought I was going to be a professor of writing, literature, business communication. But it turns out that using language can change lives. Using language, communication can save lives. And I learned over a course of about 14 years at McGee and the University of Pittsburgh Medical Center that hired me as an executive that language and communication is the heart of nursing, and that nurses change lives and save lives more than any technology, more than any physician, more than anything as a group.
Right.
My mentor there was Irma Gertzen, and she showed me service and leadership is what the world needs. And I just got that bug. Went into women's health consulting, sold that company when I had 4th-stage cancer, recovered. That was all more than a decade ago. And during COVID, my nurse friends came out of the woodwork saying, help, we got to put something together like you did before. And that's where PowerUp Nursing came.
That's awesome. Yeah, there's so much that you do that goes into Power Up Nursing, though. So my question is, that's the concept behind it, but what's all involved? What do you do? It's not just focused on well-being for clinicians.
No. It's 2 channels to PowerUp Nursing, and I
Okay.
have a lot of wonderful help on my advisory board and on our core staff. But one channel is, of course, D2C or D to N, direct to nurses, working on providing experiences that power them up. We don't really like to use the word burnout, never did. nurses knew when they signed up for nursing school that they were going to work nights, that they were going to be exhausted, that patients were going to be a pain, that doctors might be difficult, that hospitals they knew
Absolutely.
this, right?
Everything.
So
Yeah.
they're prepared, but nothing really prepared them for the exhaustion and the lack of power that has occurred
Hmm.
over the past 10 years, exacerbated by COVID. So we work from how do we power up? How do we recharge as healthcare professionals, as nurses? So we have events and travel and training and educational partnerships that are really blogs, just very exciting. With our new partnership with Moxie Scrubs, we outreach more than 650,000 nurses. Our influence
Love
is
it.
amazing. But we also learned very early on that hospitals need nurses to not just operate, but to survive. It is in a world where cost and reimbursement and specialty medicine is just burning budgets to the ground. Nurses continue to rise as the preeminent resource for rebuilding healthcare. And so PowerUp Nursing has an amazing strategic program that's being replicated in a network of hospitals throughout the United States, started here in Miami at Jackson Health, called PowerUp, whatever the name of the hospital is. And it is a program that focuses and protects and promotes the well-being of nurses as the heart of excellence in healthcare, at the heart
Love it.
of patient care outcomes. It is mind-blowing what we've been able to achieve
I love your
paying
passion.
attention to nurses.
That's amazing. And
Thank
it's just contagious, your passion
you.
for
Oh.
nursing. And I love that. Um, so as you're working with these different hospital groups, what's often the most misunderstood
Hmm.
concept or issue with nurses and their roles? And, you know, you definitely painted a great picture of why they're needed and then the value that we bring, myself being a nurse and a nurse practitioner. What's often misunderstood? Where are hospitals missing the mark on supporting these nurses?
Wow. I can say something sugary, but I won't. I want
Okay.
to say something raw. It's Nurses
Okay.
Week, and although I'm not a nurse, I have bled and structured programs and grown with nurses for the
Mm.
past 35 years. I think the mistake that hospitals make, the mistake that administrators make, and this mistake that doctors make is
Mhm.
that nurses are willing to settle. They're
Mhm.
willing to settle for the rules, for their salary, for their ceilings, for their positions, that they're just willing to settle because that's their personality. Nurses serve, support, and nourish. Maybe on the surface, but as a group of professionals, nurses never settle. And sometimes when they don't settle and instead they swallow, it turns into backlash against hospitals,
Oh, there you go.
against themselves, their
Yeah.
health, their weight, their
Mhm.
stress, their exhaustion, their
Right.
insomnia. And it is awful. And most importantly, it's awful for the nurse, but then it's awful for the patients and
For the
the
health
entire
system.
healing landscape. And
Right.
so my message right now is nurses, don't settle, but more importantly, don't pretend to settle. It doesn't do you any good, and it's ruining healthcare, and it doesn't do
Right.
your patients any good. So I'm
Right.
all about voice and not settling.
No, at first I wasn't following you. I was almost like, hey, wait, I am not one of those people that settle. However, you are right. We always try to work higher, right? We try to bottle it up, do what's best for the patient, which we're always going to do, but we don't speak up for ourselves. And so that advocacy is huge. That's a huge
Mhm.
piece. Self-advocacy, in a very organic, positive way. It doesn't have to mean that you're fighting the system or that you're bringing in toxicity or negative measures. Not at all. but just being very transparent in what you need and what's going to make it easier to provide the best patient care. So you summed it up. I love that you were raw with it. No, keep that coming. We need that.
No, and
Yeah,
CNOs will talk about, I mean, I have very
yeah.
close relationships with chief nursing executives, and they'll say, the biggest problem in nursing right now is my nurse managers and nurse directors that won't just be bold. And actually, my board at PowerUp Nursing for Nurses Month is doing a series, and people can look for it on YouTube, PowerUp Nursing. The
Okay.
series is called Be Bold, and the acronym stands for brave, optimistic, loving,
Mhm.
and disruptive. And they came up with that, and there's
Disruptive.
curriculum.
Yeah.
It's powerful.
I love it. I love it. I'm taking this all in and just listening because you know that I'm a fan of what you're doing. I think it's great. But I think that they really need to hear that raw version of the conversation, and they need to
Oh,
understand that self-advocacy doesn't mean that you're turning over tables or just saying no to pizza at Nurses Week. It means a lot more. It means being transparent and being a part of the shared governance process.
mhm.
So yeah, that's thank you for
That's
that.
your
Really
gig, right?
important.
You do a lot of shared
Right.
governance
I
and
do a lot of things. So definitely I speak of my platforms are usually, well-being, mentorship, a lot of, executive nurse leadership. So when you speak to me about these things, I'm definitely aligning with what you're hearing because I'm in these conversations with the nurse executives all the time. As you know, I chaired Ingenious Health Chief Nurse Advisory Board. So we have over almost 15 now major health systems and universities that are working together doing those same things, advocating for nurses and physicians and allied. We're working for all involved.
we
I know
would
that you're
love to
working
have
for
you
nursing.
and those nurses July 2020. Oh, I'm sorry, June 2026 in Miami. Jackson is hosting our third annual symposium, and it's going to be just you're speaking
You
at it.
mentioned
We
that.
talked
You
about it.
Absolutely. I'd be more than happy to speak. And I'm excited about that. You have something happening just this month too. So I'm hoping that, this reaches quite a few of those nurse leaders and nurse execs and also nurses. I think that they need to listen to podcasts like this one so they can stay informed of where our thought process is, what we're
Right.
working on, so they can get involved. Um, Now you mentioned definitely you're working for frontline nurses, but how has your conversation been with nurse leaders, understanding the kind of support that they really need for these nurses at the bedside?
Well, the funny thing is, and not so funny, is we live in a world that's increasingly measurable. And if you can't measure, you can't change and you can't advocate for it. And like I said, unfortunately, up until the past few years, nurses have been a soft science. And in the hospitals, we'll say, oh, let's help nurses prevent burnout. So we bring in these programs. There are programs available everywhere to help nurses be
Right.
mindful. And as somebody who is extremely spiritual, but who doesn't really ever
Right.
practice yoga, I just buy really nice clothes because I'm a personality and I can't do it. It's hard for me to buy into those systems of
Mhm.
self-care. But with AI and with things like one of PowerUp Nursing partner, great to bring them in, is this UltraHuman, a biometric ring. And it
Right.
measures, and there's others out there, but we use
Oh,
UltraHuman
that's
because
right.
it's clinically
Yeah.
not just accurate, but committed to being clinical for nurses and hospitals. But long story short, we can put
Hmm.
this, as we're doing at hospitals around the country, on
Hmm.
nurses and de-identify that data, right? So you are a nurse, you're wearing this, you
Right.
have an app, it's yours only, no one sees that data. But at the
Right.
highest level, we can de-identify groups, and a hospital can look for the first time what groups, what departments, what hospitals in a system are not
Hmm.
sleeping well, don't have good stress resilience, who are in heart rate difficulties, who are
Right.
experiencing a lot of anxiety. We can actually see We can actually put hospitals in competition with each other.
Wow. You're
And
looking at biopatterns and more physical data.
beautiful. I hadn't
Okay.
heard that before. Biopatterns, but
Yes.
biopatterns as the key to unlock
Mhm.
well-being and workforce performance in a way
Mm.
that we haven't been able to do. So
Mhm.
you
I
asked
love it.
we got on our podcast, what does PowerUp Nursing do for hospitals? Well,
Mhm.
because I'm a poet at heart, I like to use the expression we power up. So we give arm strength, right? Here's your strength, and it's arm. We go into a hospital, and with people like you and other really top known consultants, we
Mhm.
assess. We assess nurse well-being at a hospital, and we use protocols and we measure, and we do it with a large enough group that anybody that's looking at it's going to say, wow,
Mhm.
we kind of knew that, but we didn't. Then as
Right.
PowerUp Nursing, we recommend, so we've got the A and the R, we recommend
Right.
programs. And there can be very different. We don't own these programs, but we work with
Mhm.
Moxie 360 that has an app. We work with that has a mentorship program. We work
Mhm.
with other programs, one that's on workplace optimization and resilience training. Hospitals pick
Mhm.
and choose what we recommend together so we can
Right.
collaborate on a program that lives under one umbrella, an app that every
Mhm.
nurse has access to. And then the last,
Right.
the M, is we measure. We need the
Mhm.
science of this. We say that PowerUp advances the science and the spirit of nursing because there's no
Mhm.
spirit or style of nursing if there isn't
Right.
science beside it. And that's a mistake that we've all made. That's a mistake that hospitals administrators make, not viewing
Mhm.
nurses as scientists. Doctors are viewed as clinical researchers and scientists. Nurses
Mhm.
are more qualified in their scope of work to be that source of science. So yeah, so we do the arm, right? Assess, recommend,
Right.
and measure.
Mhm. Well, and something that you said just now really, really resonated with me because it's not just a measure of, before and after data. You're really looking at longevity patterns. So I like that. The question is, are we going to have nurses who are going to want to wear this all the time? I mean, that's the piece, committing to it. And I'm not sure what you're doing with that, but I'd recommend definitely piloting just a few ambassadors who definitely are going to stay committed to the process so you can really get a great measure of the progress. Because
Of
once
our
you open
first
it to the
500
yeah.
nurses that have
Mhm.
had the ring for
Yeah.
5+ months, we've only had a drop off of about 20%,
Okay,
which
that's good.
is amazing,
That's
right?
good. Yeah.
Because
That's really good.
once you wear this ring, like I had a nurse leader, a CNE, call me
Mhm.
like panicked, and she never panicked. She runs 7 hospitals. She called
Right.
me. She said, Tanya, I'm not sleeping. I lost my ring, and I
Mhm.
lost it because it's too big because it helped me lose weight. And I'm like an
Right.
addict. I've never been addicted to something, but I need my data. It helps me
Right.
every single day.
Oh,
And
once they have that measure, they want to follow it, of course. So
because
it's getting them
nurses are all about vital monitoring, right?
right. Getting them to sign on to the process is the issue, which it sounds like you're counteracting that, which is great. And then once they have that information for themselves, they're going to want to follow it. Just like my watch. The reason I ask is because I never wear it. I'm not. My husband even asked me. He's like, "Where's your iWatch?" I take it off all the time. But I think I like the idea of the ring
You could
because
shower
it's
with it,
it's
swim with
something
it.
that I never take my wedding ring off. Exactly.
The only time
Great. Yeah.
right here, I'm at my desk. The only time I
Mhm.
take it off is when I'm working and I'm not
Yeah.
moving. It's not gonna, and I'll
Right.
maybe an hour a day, just keep it there for the charge.
Love
Yeah.
it. Well, keep me posted. I'm interested in hearing more about that. And as I consult with different hospitals, I will definitely continue to have your name
Yeah.
um, at on the tip of my tongue so I can give them some information about what you're
Likewise.
doing.
Likewise.
So tell me, storytelling is huge. I'm going to pivot just a little bit back to a little bit more of our questions because I can sit here all day with you. But storytelling is huge, and it's all about power ups nursing messages that you send out. You're receiving this feedback from nurses. Can you share maybe a moment or a story that moved you deeply, or changed how you advocate for nurses? What's that one story in your head that, kept you pushing forward for them?
I it's a beautiful story because it hit me really close to my heart. I used to be 340 pounds, and for a lifetime, 20 years, I kept off a lot of that weight, and then I took off another
Right.
80 over the past 2 years. But I was at one of our PowerUp events, and as you know, many, many, many nurses are overweight. It's just lack of sleep and access to bad foods, right? And this nurse asked if she could meet with me quietly, away from the event. And I said, of
Right.
course, right? That's what I live for. That's when the big change agents happen. And
Hmm.
she sat across from me and she said, Tanya, I've been taking way too much Xanax. And I believe
Oh.
I'm a Xanax addict.
Hmm.
And this event and being here with this group of nurses has made me want to go home and seek rehab. And I'm 300 pounds and I have diabetes and I have high blood pressure. And I was about ready to quit the hospital and go on disability because my doctor suggested it. And she said, I can't. She said, because I'm a nurse
Oh.
and I gave my entire life to helping other people live healthy lives. And
Oh.
I am a horrible example of that. And thank you for being vulnerable. And thank you for bringing all these people together that are equally vulnerable, because we can not just change our life and change my life so that I don't go down in history as a drug addict on disability at 50 years old for the rest of my life. And thank you, PowerUp Nursing. And, I will forever be a part of this. Wow.
Oh,
Robin,
that's amazing feedback. Right. Wow.
and that was more than a year ago. And that, we had no money for PowerUp. We had no staff except our volunteer board. I was ready to walk away. All of my friends were putting their money in to keep this going, and
Mhm.
still owe them, but if they're listening, it's coming. But that was it. That was the injection to my soul, right? It was like,
Right.
wow, these nurses are champions, as you know, right? Everybody trusts nurses. 80% trust factor over
Right.
over everybody, priests, reverends, everybody. Um,
Mhm.
and so if we can create an army of walking healed, right? Not walking wounded, but walking healed, who are then
Right.
healing others every single day of their lives, whether they're
Mhm.
bedside or whether they're advocates like you. It's astonishing work. So I've had 3 really good
Love
careers.
it.
With the hospital, McGee Women's at
Mhm.
UPMC, one with my women's health network of 350 hospitals called Spirit Health Group. And now this is my third, right? I'm in my 60s. This is going to crown my glory. And
Mhm.
in my glory is this, to serve and to make sure that patients
I
have the
love it.
best healers beside them. And those are nurses.
I love that. I can see why you stay committed. And speaking on that, I'd love to know what you would advise other non-clinicians, because I think advocacy, it doesn't have to be a nurse. It doesn't have to be a healthcare provider. And you know how passionate I am about advocacy and elevating your voice and speaking up. I
Mhm.
think just so. What would you tell someone else who is not clinical, but because there's some passionate people out there who, I
Mhm.
mean, because we at some point, and I say this, and I know that you've heard me say this, but we will all be patients or have been a patient at some point in our life, and you're going to need healthcare. You're going to need a nurse. You're going to need. So, how can we have others speak up and
I
advocate
will
as
also
well?
say this, not only are we all going to be patients,
Hmm.
but we are all going to be healers.
Absolutely.
Whether we're caring for a dying parent, and one of my board members, Cheryl Field,
Yes.
is awesome with that. Whether we're caring
Hmm.
for our children, we're all healers. And so the precepts of PowerUp Nursing, which is
Mhm.
self-awareness, right? Sharing biopatterns, sharing what works for us,
Mhm.
self-awareness, um, creating experiences of health and measuring them and trying new interventions all the time to see what works.
Mhm.
That is good for all of us, whether you're a healthcare executive, whether you're a teacher,
Right.
or whether you work at the car wash. The other day I was at the car wash paying, and somebody noticed my ring and said, "Oh, that's cool. Is that a blank ring?" I said, "No, it's an UltraHuman ring." And I began to tell them about it and
Right.
said, "Wow, I wish I could afford it." And I said, "Well, you know what? You can make payments, right? They have this thing. You have a job, you can make payments." I went back a month later, and this 20-some-year-old girl had the ring
Mhm.
on, and she was then evidently pregnant. And she said, "I just made the decision because I want to make sure I'm the healthiest I can be for my
I
baby."
love it. Love it.
So
And
that's not a nurse. She takes money
no,
at the car wash.
I love it. And you're right about healers or caregiver, because
Mhm.
caregiver burnout is also very huge. I mean, you know, unfortunately, I lost my mom, at a young age, but I watched her take care of my grandmother who had cancer, and I watched her for months, and she herself stopped eating well and stopped
Mhm.
sleeping well. And so you're right, it's important, but I don't think, you know, in the world that we're in right now, with all of the things, and that there's lots of things, that many people stop to think about these things or other professions, as much as,
Mm.
they possibly could, because there's a lot of different fires burning around the world. So I appreciate your voice in saying that, and, making it known that it's not just, you don't have to be a provider. I mean, you could be
And the
someone
one thing,
working. Yeah.
Robin, you're right. The world it's
Oh,
really rough. It's really raw. It's
it's a
really
lot.
rough.
It's a lot.
Whether
Yeah.
you're looking at news or looking at your bank account or looking at what your
Right.
children are dealing with at school, it hurts.
Hmm.
And
Hmm.
I always say this to people that are saying, "I can't deal with all the stress. I can't deal with all the sadness. I can't deal with all the grief." I always say, just go to bed. Go to bed every night at the same time.
Some rest. Get some sleep.
Connect to whatever higher power
Yeah.
while you're sleeping. Say a prayer.
Hmm.
Say, "Please, God, watch over me. Wake me up with more energy." Commit
Right.
to that sleep. Commit to getting rid of processed and junk food in your life, getting your
Mhm.
metabolic health on track, and then commit to believing in joy. And whether that joy comes from believing in Christ or whether that joy comes from believing in loving kindness, I don't care, but believe in joy. And all the other stuff will take a secondary position. You will be healthier. When you're
Mhm.
healthier, your mental health is healthier, right? There's no difference between
Oh,
the
absolutely. You
body,
can't.
the cells of
Yeah.
our body and the cells of our brain are one and the
Right.
same. And then we
Mhm.
can just make the world less messed up and process things better. And that really is the truth. The truth.
No, you're right. Honestly, if you're faltering in one element, of your life, whether it's finances, mental health, physical health, it affects your whole well-being. So I thank you
So
for
many
sharing
people
that
turn
with
to
them.
drugs, Robin. They say,
Oh
"We're
my
going to go get
goodness.
Xanax or we're going to go get whatever the doctor will give me." I always
Mhm.
say, "That's fine, but do me a favor. Let's try a couple weeks of sleeping first." I am not a nurse, but I am a nurse educator. I was trained. So I keep my hands in by working for a cardiologist, and I do education of people in heart failure, advanced heart failure. And I have
Mhm.
learned more from them than I could ever educate them. And one of the things that I've learned is that medication doesn't work if you
Right.
don't believe that you will get better.
Absolutely, and compliance. So, and I'm glad that you do patient education and that you stay connected, because hearing the voice of those we're caring for, that's important as well. Well,
Mhm.
I know that we're getting close to time, but before we wrap up, I just wanted to know what's next for you and Power Up Nursing.
Wow, that's fun. I think that in the next 3 years, we don't do 5-year plans anymore in this world. But in the
Yeah.
next years, we will have a network of at least 100 hospitals in the United States. And
Mhm.
from that 100 hospitals, those learnings will be enough to go global with this and to be cost effective with AI, be cost effective with technology in order to
Right.
provide nurses around the world with a blueprint for well-being that helps them improve patient care. And that's really where my mind is at. I haven't shared that with my board. So hello, board, if you're watching this.
Hello, everybody. Surprise. Well,
That's
I love it. And
vision.
it has been a pleasure to have you on the podcast today. And I really thank you for being here. And, there you have it, everyone, from Tanya Abreu with PowerUp Nursing about all the great things that are happening, why you should support nurses and advocate for nurses, and healthcare leaders should connect with her so that we can improve things for those on the front lines.
And I'm easy to
Tanya, it's been a
connect with.
pleasure.
It's Tanya at powerupnursing.com.
Thank you so much for sharing that. I was just about to ask, how can they connect with you? Repeat that one more time.
Tanya, Tanya, at powerupnursing.com.
And we will definitely include that in your bio so they can connect with you. Thank you so much for being here.
Thank you. Thank you. I hope to see you at the end of the month, Robin.
You'll see me soon. And to our listeners, we hope that you'll join us next time on the Clinician Voice.